important topic. Toni Bulthuis is our presenter today, and she's received her BS in nursing from Trinity Christian College and has 32 years of experience in healthcare. She's worked at Holland Hospital, Hope College, and since 2019, she has been the immunization supervisor at the Ottawa County Department of Public Health. So let's give a warm welcome to Toni.
Thank you. And thanks to Jane for inviting me. This is, we're finally through our back to school season, so we can breathe just a little bit at the health department. And so that's always our craziest season, anywhere from June and through August and into September, getting all those kids ready for school. So, yeah, and I did graduate from Trinity, worked at Hope in the health center for 13 years. That was the best mom job I could have ever had for the students. I had most of my summers off. It was great. I started my career in pediatrics, so I kind of moved up in age, but I worked at Loyola University Medical Center in Chicago for a few years. That's when we lived in the Chicago area, and then worked outpatient there, moved up here, and my sister-in-law knew someone who worked in the health center and said, "Hey, you got any jobs open at Hope?" And it was fantastic. So I was able to work in like a nurse practitioner role, that we worked under medical director orders in the Hope College Health Center. And so it was a great role as a nurse, that we had that autonomy to be able to do that and assess and treat students. So I love that job. Moved into a care manager position at Holland Hospital. Very short stint. I determined that was not for me. And then Sue, the former supervisor at Ottawa County Department of Public Health Immunization Department, I knew her and she said, "Hey, Toni, there's a part-time job open. You want it?" And it was great. And I made the move and I haven't looked back. Although once I took the supervisor position in 2019, I felt like God played a joke on me because COVID hit. And I was barely in that position and still learning so much about it. So I went from learning to fight or flight, right? And so we've made it through, and we've had, some other fun moments after COVID that you may have heard about with our county health department. So we're making it, and any support you give, we sincerely appreciate it. So it means a lot, and there's a core group that we have not left, and we hang together. So we do appreciate it. So I'll get going here. All right. We're not going. There we go. Amy. Watch, I bet the battery just died. I had a great morning, so let's see if this actually works. It's not working.
Take the mouse on the computer and click the PowerPoint screen first. Now try advancing it with the laptop. Okay, now the remote should work.
It'll work now. There we go. All right. Okay. Goodness. Bad things come in threes, and I had them all this morning. So I can't have any more. All right. So these opportunities that I get invited, or any of our team get invited to speak, we appreciate it because it starts the conversation. There is a lot of vaccine hesitancy out there. There's a lot of questions about safety in, vaccines, and we think COVID-19 kind of brought that up to the surface. It was bubbling there before, but we appreciate this time so that we can have good conversation and just go with educating and helping people understand. And we're in a different time than we've ever been before, with some distrust. So we're trying to gain people's trust back, and that's what we need. So we appreciate this. All right, so agenda introduction's done. I'm going to go through our immunization program at the Ottawa County Department of Public Health. It used to be Ottawa County Health Department, but there's 2 OCHDs in Michigan. So we became Ottawa County Department of Public Health. It is a mouthful. So OCDPH is what we are referred to. And then I'll go through recommended vaccines for most adults. We'll go through some extra ones that some people require, but we'll go through those. Side effects of vaccines versus adverse events. Which is which? we'll go through that. We'll talk about MICR and what MICR is, our state immunization registry for everybody in the state. And then I'll just do a quick review of the recommended childhood vaccines, and then we'll have time for more questions at the end. So we will get moving. Our mission statement is pretty simple, but I think it encompasses a lot. Our vision is just healthy people for here in our community, whether we're on the border of Allegan County, Kent County, Muskegon County. It's for everybody who comes to us for care. We don't have to just care for Ottawa County residents. We can see anyone who comes to us. So that is, crossing borders so that we can help out our whole community. Our mission is work together to assure conditions that promote and protect health, which our departments do. If you think about the departments at the health department, we've got our clinic services, which are immunizations. We've got our family planning sexual health clinic. We've got our environmental health. So we've got recycling, we've got the food and the restaurant inspectors. Lost that for some reason. Sorry. And, and we've got the inspectors who check all our wells, our waters, making sure that there's not PFAS. So it encompasses a lot. It's not just our clinic services. And then our values: treat everybody equally. We want equity, integrity, and excellence. And that is our goals. So now specifically for our immunization program, we offer vaccines for adults. We offer vaccines for children, travelers. We do have a travel health clinic. We have a lot of people seeking immigration vaccines, going through the process of immigration. And then we also see people who maybe have a medical condition that their doctor doesn't carry their vaccine. So we can see them at our clinic for that. And so vaccine opportunities at our health department include what we have is a VFC program, Vaccines for Children program. This is a federal program where we get free vaccine, completely free vaccine. It is for children 0 to 18 years of age. So through the whole year of age 18, so 18 and 364 days, we've even given vaccines. And so this is when they would have Medicaid, uninsured, underinsured, Alaskan Native, or American Indian. All of those fit under the VFC head, and we can give this free vaccine to. Some offices in Ottawa County also carry Vaccines for Children vaccine. So patients and children are able to stay in their medical home to get those vaccines if they're uninsured, if they have Medicaid. There are some private offices in Ottawa County that do not carry VFC vaccine. So those children would see their physician for their a well child visit, but then they would come to us for their vaccines. And then that head, or all of those vaccines, it's any vaccine that is approved for use by the Academy, or yes, the Advisory Committee for Immunization Practices. So ACIP. And that is made up of individuals from all different I would say practices and studies. We've got professors, we've got medical directors, we've got pharmacists on there. We have the head of the respiratory division of the NIH. All of those people have been on this ACIP committee, and they make very good decisions. They decide whether it's ethical, whether it is if it's cost effective. So there's a lot of decisions they make, and they are the ones that set the recommended schedules for vaccines. So that is what we follow, is that guideline set by the ACIP. We also have MIAVP, Michigan Adult Vaccine Plan. This is kind of, I don't know if you've heard a little bit about it, but President Biden wanted to have, kind of starting with COVID, but wanted to create a universal adult vaccine plan for people who are uninsured, completely uninsured. That has not moved forward, unfortunately, but Michigan still has this for residents of Michigan. So there are some vaccines that people can come to us for if they are uninsured, which is great because we are finding that there are people who cannot get vaccines if they're uninsured. And we're finding that with new vaccines coming up, that they're not part of any kind of program. COVID had the Bridge program. The Bridge program Well, when did it end? August of 2024. The Bridge program was free COVID vaccine for everyone who was uninsured. That program is gone. So now what do these people do for their COVID vaccine? So Michigan there are some doses in Michigan, in case you know anybody or you yourself is uninsured, there are some doses of COVID vaccine for people who are uninsured. Our department has a few, but there are some throughout the state. We had to ask specially for that. So there are some cases at our health, or some doses at our health department of COVID-19 vaccine that will be free. So for those who are uninsured, certain vaccines are included in this program, certain vaccines aren't. But it's a really important program and it is used every single day in our department for adults. We see a lot of people who are coming for immigration who are not insured. Some people who are coming for immigration have Medicaid. So that's a private insurance. Now, the VFC program, there's some good statistics that just came out recently. The VFC program started in 1994. That's when my first daughter was born. And I remember actually utilizing the VFC program because when we had insurance back in the 90s, it was not required of insurance companies to cover vaccines. Preventative care was not a number one, right? It was almost reactive care. So my family and my children, we utilized the VFC vaccine program back in Illinois. It was brand new. We were learning about it. That's when I started working in the outpatient center and I started actually giving VFC vaccine. So, but they did this because there was a measles outbreak between 1989 and 1991, where they decided that that children needed that second dose of MMR. However, a lot of people didn't have their children get that second dose of MMR for full protection because they couldn't pay for it. It was an expensive vaccine. So our government said it is time for us to start funding that if we are saying that vaccines are important for children, we need to fund it. So that is how that started. And then this is a really good fact, and I'm going to read it exactly because I don't want to mess it up. So this recently came out it's called an MMWR, Morbidity and Mortality Weekly Report from the CDC. And the MMR states, and this was all about how the VFC program and the impact it has had on disease in our country. So among children born from 1994 to 2023, routine childhood vaccinations will have prevented 508 million cases of illness, 32 million hospitalizations, 1.1 million deaths. The societal savings is $2.7 trillion. So this is what this program has done for children and for the health of our nation. Another vaccine opportunity that we have at the county, we talk about our vaccines in stock, right? So we have public stock, which is what we talked about with VFC, MIAVP stock for those uninsured. We also have private stock vaccine. Private stock is for people who have commercial insurance that we can bill. I'll talk a little bit about that. We contract with Priority Health, Cigna, and Blue Cross Blue Shield. So we can bill those without an issue. If somebody has another insurance such as Humana or Aetna, some of the other ones that we're seeing lately, we can't bill those. They'd have to pay out of pocket. We do have people send in their receipts and we've heard that it is successful because we're not an in-network kind of a thing. People don't see us as a Corewell Health or a private provider, but a lot of times people do get reimbursed from their health insurance company when they come to see us for vaccines. I am hoping one of my goals for equity purposes is that we will start contracting with more insurance companies so that we can see more people it takes away that barrier, right? I mean, some people don't have that money out of pocket. That's a lot. Vaccines aren't cheap. And so that's a lot to ask of them to do that. We can bill adult Medicaid, most of them, which is great. Medicare billing, I'm going to tell you, is a little tricky with us. So if you call for a travel visit or anything like that, we'd probably have to ask you about all the insurances that you have because Medicare is not fun. That is one thing that my nurses and I talk about a lot and something that we're even, bringing up to executive leadership. we know more about insurance than probably any hospital nurse, ER nurse, doctor's office, because we have to sit there when we get a phone call and we have to figure out what insurance covers it, because we don't want anybody to have to pay anything out of pocket. And that would be awful for somebody to come to us and they all of a sudden say, we don't take your insurance. So that we sit and figure that out for every travel visit that we do. We figure that out before people come. And it is really hard. Sometimes we had somebody come and say, I have Medicare. And we're like, great, that's awesome. Well, they had two Medicares. One was primary, one was secondary. Primary wouldn't pay. We don't bill secondary. So we felt terrible because it just was a lot of work for that patient and we don't want to cause that. So we do our best. Our vaccine budget has been somewhat limited in the past couple of years. It's not that any money has been taken away. We've just seen a very large demand on the use at our health department. A lot of it is immigration, which is wonderful. I mean, these are legal immigration. These are people coming from Cuba and Haiti who are coming, Haitian people coming legally through the federal program, and they're doing it, and it's by air. So they do all their paperwork in their country. They're all approved. There was 30,000 people allowed to come a month by air. If all their paperwork is done correctly, they would come here, they would get Medicaid, and then they're looking for immigration. Number one, they're looking for a job. And then number two, they would come to us to get their immigration vaccines. So there was a large demand and a large push from us for vaccines. Because of that, we're a public entity, right? When we get reimbursement from any insurance company or Medicaid, that doesn't go back in my budget that I can pay more. It just goes to the general vaccine budget. So once I have a budget, that's what I have set for the year, no matter how many people come through the door and need that private stock vaccine. So when I have $132,000, that doesn't go very far for a full year for vaccines, when some of them are $250 a piece. So we're working. I got more this year. So that's a really good thing. I can celebrate. But once again, there are more demands on us because there's also brand new vaccines that we're required to carry, which I'll get to, but some of them are very, very expensive. So we do the best with what we can. We are still offering travel. We're still offering immigration appointments. We're giving them, people the vaccines they need, referring to the pharmacy if we have to. I don't like doing that. That hurts. We want to get everybody vaccinated. We don't want to miss an opportunity, but we're doing the best we can with the money that we have. So our responsibilities at the immunization department, this is something that a lot of people don't know the background of. We have a clinic, right? We vaccinate people. This is what we do. We put vaccines in arms and babies' legs and, give them their little rotavirus vaccine, drip it in their mouth. But these are the things that we also do. We do waiver education appointments. Our nurses sit down because it's required. Public health law requires that children are vaccinated for school. If parents choose not to vaccinate those children, then they have to come in and get a waiver appointment with us to learn about the risks of the disease and also about the risks of the vaccines. So we will sit down with them and have that conversation with them. And then we have to give them proof that they've been in our office, either paper or it's electronic now in the immunization registry. And then the schools are aware that that waiver has been done, because children or the students really aren't supposed to be in school if they don't have a waiver or completely up to date with their vaccines. So those we did, I was going to get this data before I left, but last year, 2023, we did 660 waivers. Probably 80% of them were between June and August. So, and I know our August this year, we did 350 just in August. So it's a lot of time. We found ways to schedule it better, which is great. And parents have found that putting things in MICR, it's a lot easier than what it used to be. They used to have to go to the school and bring a paper there. If it's in that system and the school secretary looks, it's all good. So I also hold provider meetings. So the private providers, we call them private providers just because they're not public with us, but it's doctors' offices all around Ottawa County. So we invite anyone who wants to come to listen to my vaccine updates. I only repeat a lot of the things that come from MD, HHS, and CDC, but it works much better as I'm kind of one little information set instead of people looking in all different websites and all of that. So I try to keep offices up to date with immunization schedules, things that change, insurance changes, et cetera. So I try to hold those 3 times a year. VFC providers, like I said, there's some offices in Ottawa County that have that vaccine for children vaccine. There's 17 offices currently and 2 hospitals. The hospitals have hepatitis B vaccine for infants so that they can get it free, no matter if they're insured or uninsured, they get it at birth, they get that first Hep B vaccine. We have to go in and do inspections in all of those offices once a year to make sure they're holding that federal vaccine correctly, that they are inventorying it right, they're not tossing it. They have to do paybacks if they accidentally, open one that it wasn't supposed to be. So this is something that we are charged with by the CDC because it is a CDC vaccine. And so that's why we have to do that. So that's extra work over and top that of our normal day to day. We get emails, calls all the time from providers. Hey, I accidentally gave, this vaccine. Is it okay for this age? Or, hey, I've got a kid here with a stem cell transplant. What vaccines do they need? What's different? So we do a lot of that. A lot of that does not count in, some data that, people want to know in our clinic. What do you do all day long? This is what we do all day long. We do temperature monitoring for our own vaccine. We have to do that in the morning and in the evening. We have to know min-max, what the minimum temperature has been over the last 24 hours, the maximum temperature that it's been over the last 48 hours. We have to do inventory reports also that we send to MDHHS, Michigan Department of Health and Human Services, for our own inventory. And then we also review all those 17 offices and 19 hospitals. So we do that monthly also. And fortunately, I have a nurse who is my right hand and she's amazing and does almost all of that for me, and an immunization health tech who reviews all those offices, all their reports, make sure their inventory is correct. And then we also have school reporting. All those school requirements, we have to approve. All the schools in Ottawa County approve that all of their kids are up to date with vaccines or they have a current waiver. And so we're emailing and back and forth, like you still have children on your roster that are incomplete. We need to have them complete. So that is for child, and that's for childcare also. So October is childcare reporting, November is school reporting, and then February school reporting again. If they do not hit 95% of all of their kids are complete, their state funding, 5% of state funding will be taken away. So they have to meet that by February. So that's something, we're kind of that gatekeeper between us and the state and the Michigan Department of Education. So why do we vaccinate? So we vaccinate for our own personal immunity and we vaccinate for our community to protect others. So this is Dr. Offit is a world-renowned immunologist. He actually worked on and helped produce the first rotavirus vaccine. My son was in the age group that he received that first rotavirus vaccine that Dr. Offit had helped with the producing that. And this I'll get to in a minute, but one of the safety things is all of a sudden I got a phone call, or I went to the next doctor's appointment to get the next rotavirus. It was recalled because they saw a signal, possible some intussusception on it. So that is a little snippet of what our safety data does, right? So I'm a personal experience of going, hey, they do the right thing. They know it might be. They did a lot more testing on it and found that it didn't, but they also got a new rotavirus vaccine going. But I like to tell that story. But 9 million Americans are immunocompromised, either because of medical condition or treatments or therapies. So those 9 million might not be able to ward off one of these vaccine preventable illnesses, even if they're vaccinated, or they've had a stem cell transplant. They need to start all over. That's even baby vaccines that we're given again. That DPT and the Hib and the pneumococcal start all over again. So we want to make sure these people are covered too. And, as a community member, we have a responsibility to not infect others if we have the ability to. Vaccines and public health. Vaccines are one of the most effective public health tools that we have. Some people have said even one of it, they even call it actually a miracle, because How many children used to pass away from some of these diseases, from Hib meningitis, pneumonias? My mom had siblings pass away when they were 2 years old. Probably meningitis is what she told me. She, she was a World War II nurse. She knew the worst of the worst. She had friends who had polio and were permanently maimed from polio. So when I took this position and she was still alive and she said, you do some good out there. She said, people can't not remember what happened. And so I try to bring that also is what she used to see. Her siblings passed away. I went to go visit her cemetery plot and looked back in the cemeteries for our church specifically that I grew up in. And there's got to be 40 to 50 infant graves in the back. And I don't think people remember that. And they think, oh, we have clean water. Oh, we have medical therapies that will help us now. Some of these, there are no therapies. There's nothing to do for measles except supportive care. So that's where we have to kind of educate and remember that. So we get positive health outcomes from being vaccinated, right? And decrease medical costs. We talk about economy, right? So let's think about the cost of a vaccine. Yes, some of them can be very expensive, but what is the cost of a hospitalization? My grandson had RSV last year. It was right as the RSV monoclonal antibody was coming out for infants. There was no stock for him to get one. He ended up in the hospital for 2 nights, 3 days with RSV. That hospitalization was $8,000. The monoclonal antibody is $500. What is most cost effective? Granted, $500 is hard to swallow. I have a hard time purchasing it when my budget's not real big, going, how many doses can I buy? However, that's the reality of it, right? All right, so Michigan immunization rates. I was going to open this link, but it doesn't work open very well for you, but you guys should have in front of you. If you even want to Google county quarterly immunization report card, you will get a website that is absolutely amazing. MDHHS did a really, really good job on showing our immunization rates across the state. You can pick by county even and see what our immunization rates are. It's great. Except that you see, well, I'll go this way for you, but that decline in immunization rates on those graphs right now. Ottawa County, it's good news. We are actually over state averages though. So that's a good thing. We're still above state average, but we're not as good as we used to be. So if you look up in the far right corner, so our county immunization rank, and it says N equals 84, that's 84 counties. And if you look at these numbers, 431, 331, 42, that's just the infant immunization series. So that includes the ones that they would get before the age of 3. So that would be 4 DTaP vaccines, 3 polio vaccines, 1 MMR, 3 Hib, which is H influenza, 3 hepatitis B vaccines, 1 chickenpox vaccine, 4 pneumococcal vaccines, and then 2 hepatitis A vaccines. So that's what they would get before age 3. That seems like a lot, but it's just boosters of some of the ones. We used to be 2, we're dropped down to 5. We used to be second in the state. So the hesitation has hit us here. And then the teens, so they have a little bit of different requirements that we go through. So that's a Tdap, that's polio, 2 MMRs, 3 Hep Bs, 2 chickenpox varicella, 1 HPV, and then what's our last 3? No. 1 Tdap, and then 3 HPV are up to date. That's number 4. We've always been around there with our adolescents. And flu coverage, we used to be around 2, number 2 in the state. So we're dropping down. But like I said, we're still ahead of the state. That's a good thing. That's a really good thing. You can look at all the kids' numbers right there. The adults, we actually look at us. We are good in Ottawa versus Michigan average. If you look at 1 Tdap, so if you're up to date with your Tdap, we're at 69%. 1 pneumococcal vaccine for 65 and older, we're at 73.2, and 1 shingles vaccine or the zoster, we're at 62%. So we are actually doing really good in Ottawa County, which is great. So that's awesome. The other thing to take note of when I talked about waivers, the state is really looking at that closely. The school and childcare waiver percent has gone up for us. We used to be at 4.1, we're at 4.8 now. So there's more children waiving vaccines. I should say parents are waiving the vaccines for the children. And there's actually quite a few of children who are fully immunized all the way up to 7th grade, and then parents decide no. So they're without, and then we have that blank one. So here is that. So why are immunization rates decreasing? I've hit on this a little bit already. There's not good reasons, but here's some solid reasons, right? Disinformation. So what is disinformation? It is false information deliberately and often covertly spread in order to influence public opinion or obscure the truth. So people who are purposely sending out that information, that's disinformation. Misinformation, a lot of times people just pass along misinformation. They think it's true, it's not. So they're passing along. Somebody told me, or, this was on Facebook, or, and sending it along. And so without checking the facts or the data. Some people, we've gotten this information from actual visits that we've had with waivers. People don't want the government telling them what to do. And so they have said no to vaccinating their children because it is required for school. Public Health Law of 1978. We didn't just put this law into effect. It's been around since 1978, which is what we follow. There's distrust in the scientific community. Unfortunately, that came from COVID when there was mixed messaging and not really good communication, or, overall it's mixed messaging, right? It's wear a mask, don't wear a mask, and it's what they knew at the time. And isn't that what research is? You know what you can know at that point in time until you get more data, right? A lot of people haven't understood that, or it's hard for them to understand. And then a couple other things that aren't necessarily thought process wise, but it's inconvenient. Some people, it's just inconvenient to go get a vaccine. You almost have to go to them, which is fine. We can do that too. We offered homebound vaccines during COVID, which was an awesome service. Don't have the funds to do that right now, but maybe maybe we can in the next couple of years. We've got a focus to do more outreach when we can. And so that's our goal, is to get out there and do more. And that also goes along with contracting with more insurance companies, because if I'm going to go out and vaccinate kids, I need to be able to build the insurance companies. I can't say, oh, I can only give vaccines to these. I want to be able to do everybody that walks up. Or we just have a huge budget. They're going to love me and they're just going to give us all we want, right? I don't know about that. But there's the disinformation dozen out there. I don't know if anybody's ever heard of that. There's about 12 people that spread 90% of all the disinformation there is about vaccines. And one was a presidential candidate, Robert F. Kennedy. Very, very much disinformation. And he is paid by a vaccine hesitant group, very large amounts of money to represent them. So I'll just leave it at that. It's a worldwide issue. You think a lot of times I think it's only us. I'm like, why do we think we're so good at, but it's not. It is in Europe. European countries are pushing back to people. They're not vaccinating. There's outbreaks like crazy of measles. Ireland, the UK. So we're not the only ones that are dealing with this. It's and even in the Middle East, actually right now, some of the people who are going out to do polio drives to give kids polio vaccine, they had to stop because of the violence toward healthcare workers. So they were not allowed to go into some of these cities because the risk of them possibly being killed. So there's countries that it's better or worse, or there's times that it's better or worse, but we know that is happening. Vaccine hesitancy is a top 10 global health threat, according to the World Health Organization. And that came to the top 10 in 2019, and it's still there. And that was before COVID. So we got to think about that. The hesitation was already happening. We got our work cut out for us. So any questions so far? I'll just, do you want to?
If you could speak a little bit more about the fact that students or children do not have to be vaccinated to go to school. I wasn't aware of that. And you mentioned a law from 1978. Can you give us a bit more detail around that?
You bet, you bet. Our public health code of 1978 requires that children are vaccinated for school. However, Michigan is also a state that allows philosophical or religious waivers. So parents can say on a religious reason or a philosophical reason that their children aren't vaccinated. And so they can actually be in school and not be fully vaccinated because the parents are waiving out of those vaccines. California has gone the other way. There is absolutely no religious or philosophical waivers allowed in California. But then there's been a lot of pushback. I believe it was Mississippi that just started allowing philosophical waivers and religious waivers, and their waiver rate has gone up tremendously. And their vaccination rate was in the 90s. It was fantastic. So it is unfortunate. And there is been talk in Congress, in the state Congress, to open that public health code, because there are some things that in that public health code that were from 1978. There were no electronic waivers. It talks about paper immunization records that people have to get, so there's a lot of things that could change, that really should change, because we're following rules that probably don't apply, but we have to because it's in the public health code. So yeah, that we have religious or philosophical, and people, if they're supposed to write a reason for philosophical, a lot of times they just write other, or they tell us, nope, we're just doing religious. And we can't question them. So, yes.
Yes, I was wondering about the PFAS you talked about. I understand exposure to PFAS as a young child could affect the effectiveness of vaccination. Is it true?
I do not believe so. It's not something that I know, but I could look into it. Yeah. I will do that.
So with the question with religion, the person just has to check that in the box. There's no backup from your church. But that issue came up a couple years ago. I forget, when I was working at the hospital, there was an issue about, well, should we have someone verify or have a discussion with their clergy and then, verify, yes, this person, is doing this for religious purposes. But that's not the case today.
The state doesn't
No.
require it. Unfortunately, they don't. There's been studies, and a lot of people, there's not one religion that says you can't vaccinate, and the Vatican actually put out a letter saying even with the vaccines that have used fetal tissue in the past, there's no new fetal tissue being used. It's from lines in the 1970s, and the Vatican said in that letter that it is more responsible to be vaccinated within your community than not take the vaccine.
The issue of mis and disinformation related to vaccines, how much effort is being put into really dealing with this at the national level? I just want to tell a short story. I was driving between Green Bay and Milwaukee right after the COVID vaccines came into use. Turned on a radio station that my parents listened to all the time, Wisconsin Christian Public Radio. What I heard when I put that on, this is 3 years ago, is that the people are dying from the vaccine, and it's really ridiculous. It was spreading fear and about this. I thought to myself, I gotta get off the road here, because what I'm hearing is so jarring that I can't even keep my eye on the road. This is a real problem. And just like in every other area of our culture right now, religion, politics, education, you name it. This idea that is real,
Mhm,
that these things are causing
mhm.
all kinds of, even today, I talked to a nurse a couple of weeks ago.
Mhm.
She said, well, all the side effects now from this, all the stuff that's going wrong, infant mortality and infertility and on and on and on are all problems.
Mhm.
What, I'm sure there's something that happened here
Yep.
that screwed up, but
I was at the National Immunization Conference in August and in Atlanta. And actually that is the CDC's focus, is getting the trust back and getting the truth out. The problem is, we all know lies travel farther than the truth and quicker than the truth, right? And so we have social media right now. The statistic I just read was 50% of people get all of their news information from social media. And that's not including NPR, BBC, that is social media, Facebook, right? So, or Instagram or Threads or Twitter or Truth Social, so that's where we're looking at. It's going to be hard to go backwards. And I'm going to be honest with you, I have people in my own. Mhm. Exactly. And that's hard because, I've had people when I've sat in education appointments and with the waivers, and they told me that we have perfect immune systems because God gave us a perfect immune system. I said that the last time we had a perfect immune system was in the Garden of Eden, and we would not be getting cancer. We would not be ill. We would, and she didn't know what to say. That came out of me so fast. I almost had to apologize, but I'm a believer and I'm like, sin happened. Right. And so that's where, it's a hard road to walk. And sometimes it's a hard discussion to have. And so yeah, we're doing what we can't do much in Ottawa County right now. I am trying to stay under the radar so I can still do my work and do it well with my team, without causing waves.
Do you ever have any success when you have these appointments and then people say, oh, well, I didn't know that. So,
Yes,
okay.
yes. It's hard to know though. Sometimes they have their children with them at the waiver appointments, which is fantastic. And if we accept their insurance or their Medicaid, we're like, hey, do you want to be vaccinated right now? We probably have 2 or 3 of those a year that we can do that. That's it, and what we always have to say is we plant the seed, right? We can't do anything else but plant the seed. We've had people come in with their political t-shirt on, not wanting to listen to us at all. And I had a nurse actually get through to him and he said, I never knew that was a risk. I never knew that my kid could die within 24 hours of getting meningitis. And he says, I'm going back and talking to my wife because I think she sent him to do the waiver and do the dirty work, but it was a learning experience for him. And he thanked my nurse, like, I really didn't know that. So we don't know if they vaccinated their kids or not, if they went back to their provider or not. So yeah. They did get a waiver, especially if they know other kids, they want the waiver to get in school and then they'll, hopefully change their mind. Yes. Another question.
If a child is immunocompromised.
Yeah.
And there's another child that has a waiver in the classroom, how is that handled?
That, they're allowed to be there.
Yeah, but are they switched to another classroom or all the?
No, because it's medical information. So it's all up to the parents and it's private, it's HIPAA. So, you may not even know who is vaccinated or unvaccinated in your classroom. Unfortunately.
And how has your funding changed in the last 2 years?
We were fully funded. We ended up being fully funded because we're funded by grants. The general fund had to fund us. I had to match that grant. So, we had the exact same funding as the prior years. But we could use more. I could use more. So I had asked for more last year because we knew of the immigration stuff coming in, but they couldn't do it. So, or what? Yeah.
Any more
Any
questions?
more? I'll get going. All right. So adult immunization recommendations. So I'm just going to go through the ones that are on the routine schedule, and then there's some outliers that we'll go through. There's COVID, flu, RSV, Tdap, pneumococcal, shingles, and hepatitis B. You guys probably are like, hepatitis B? I didn't know I need that. That's a newer thing, so we'll get there. So COVID-19 vaccine, there are 3 COVID vaccines that are approved in the US. So there's Moderna, which the adult is officially approved. So then that name is SpikeVax now. I don't know where they come up with these names. I want that job. I want that job. Get paid the big bucks to come up with these crazy names. Pfizer is Comirnaty for the adults. And both of those are mRNA vaccines. And then there's Novavax, which is a protein subunit, which is like the rest of the vaccines that we get, where they use a part of a protein of the virus to create the vaccine. And so the website here is listed. I'm not going to go on it, but it is really good at describing in lay terms the COVID-19 vaccine basics. So about mRNA and Novavax, et cetera. It's important to remember there is not one of these that's preferred over the other. So whatever you're eligible for, or your child or your grandchild is eligible for, they should get that vaccine. And it's not perfect. Our hope, I know that this is going through the news again right now, is like, it doesn't prevent infection. So why do we have to get it, right? Well, you know what? It's a respiratory virus. Our hopes were, when we came out with that first vaccine, we saw the rates like drop dramatically. It was almost to nothing. It was God's gift to me because I had my daughter's wedding planned in June of 2021. And I didn't think I could have her wedding because I worked at the health department. I thought, if I hold a wedding, what do? I can't hold a wedding right now, right? And my daughter was like, nobody's wearing masks, that kind of thing. I have a daughter who doesn't, always agree with me. And so so for me, as soon as we could have groups over 100 and we didn't have to wear masks, and our wedding was outside, but it was that all of a sudden, that decrease, that thought, we were thinking this was the best thing since sliced bread, right? I remember, it's Ruth, I'm going to call you out right here, but when Robin, her daughter, works for me and gave that first COVID vaccine at that first clinic, I cried. I sat there and I kind of like got choked up in the corner. But that's what we thought it was going to do. But the bugger changed on us, didn't it? It mutated, and that's what respiratory viruses do. So it doesn't necessarily prevent infection, but it is going to help prevent you from going in the hospital if you have any kind of complications, which is huge. So that's important. Once again, cost, benefit, risk, benefit. You're not going to the hospital. You might be home with a nasty cough for a week, but you're not in the hospital. And those with the highest rate of hospitalizations, infants under the age of 6 months, because they can't be vaccinated. And then those over the age of 65. And those infants, though, they could be protected by mom if mom got that vaccine during pregnancy, because it does go, that immunity transfers over. So we would love to see moms being vaccinated to prevent those babies. So recommended age for everyone is 6 months of age and older. So I'll quickly go through these. The current vaccine recommendations for those who are not moderately or severely immunocompromised. If you've had no prior vaccines, it's 1 dose of Moderna or Pfizer or 2 doses of Novavax. You'd start new, you'd get that back. You'd start like you wouldn't have to do the 3 doses, et cetera. We're back to just 1 dose or 2 doses of Novavax. If you're previously vaccinated, it's 1 dose of any brand of the vaccine will fulfill your recommendations. I personally have had Pfizer, Moderna, and Novavax. So. Nope, not really. Whatever's available. Yeah.
Can you repeat the question?
Oh, sure. She asked if one was preferred over the other for any reason. Not really. No. Some people have had a stronger reaction to one over the other, like a sore shoulder or body aches or fevers. I had a swollen lymph node and some body aches with one, migraines with all of them. Just a reaction. I'm a migrainer. So, I prepare for it and I know it's going to happen. If that's all that I get, I'll take it. So anybody who's moderately or severely immunocompromised, you can get additional doses. Have that conversation with your physician because you can get additional doses of that season. So somebody who gets their COVID vaccine right now, who is immunocompromised for either medical or for therapy reasons, can get another one in a few months. Talk to your physician when they would want you to get that. So here's just a list of examples of immunocompromising conditions. So I'll leave them up there. So high dose steroids, any cancer treatments, any biologics, because a lot of our medications are now like antibodies, monoclonal antibodies or biologics. And our flu vaccine. So that's next. Everyone 6 months of age or older is recommended to get a flu vaccine every year, except for a few rare instances, those people who might be allergic. It's also important for those who may be at risk for complications due to flu to get that vaccine. So anybody who's got asthma, heart disease, history of pneumonias, congestive heart failure, those are the high risk ones, but we really should emphasize those people. Anybody living in a nursing home or assisted living, close quarters, people who, this is new in the last 2 years. It was always, oh, I'm allergic to eggs. I cannot get the flu vaccine. That has changed. If you have a allergy to eggs, you may get the flu vaccine. So, and either egg-based or non-egg-based, there's both kinds. And all flu vaccines are trivalent this year, 3 strains. They've been quadrivalent with 4 strains for the past probably 10 years. They have now switched to trivalent now. So it's 3 strains. They got rid of one. It's called B Yamagata strain. They got rid of that because they have not seen that in circulation at all in the last probably 4 to 5 years. So why put it in if we don't need it? So they did switch it to trivalent. So what is flu? Flu is not nausea and vomiting and diarrhea. We are terrible. I grew up saying I have a stomach flu. No, you don't have a stomach flu. And we still say it, some people say, I'm not going to get the flu shot. I don't ever throw up. No, that's not the flu. That's not the flu. It's fever, body aches, headaches, severe cough, weakness, nasal and chest congestion and fatigue. That's the true influenza. Believe me, I was at Hope College when they went through the norovirus. I know what gastroenteritis is compared to the flu. So we had kids throwing up on the floor in front of us. So types of flu vaccine, there's 2 types. There's the injectable, and then there's a nasal spray, actually. The nasal spray is coming back into popularity a little bit. Nasal spray was off the market for a little while because when they tried to make it a quadrivalent, it failed miserably. It did not work at all that season. So they took it off the market for a couple years, got it to work, and now it's coming into popularity. A lot of people like it who don't want an injection. And so nasal spray is a possibility, but it's only for ages 2 to 49, and they can't be pregnant, and certain medical conditions cannot get it. There's certain injectable vaccines. There's many brands, certain ones just for adults 18 and over, and some just for adults 65 and older. So for people 6 months through 64 years, there's no preference on any brand, anything that they get. Just an age appropriate vaccine you're eligible to receive. For those 65 and older, there are 3 vaccines that are recommended because these are known to give a better immune response. As you get a little bit older, your immune system wears out too. So the flu vaccine has a little bit more oomph to it for these people. So it's a high dose flu zone, 4 times the antigen as standard flu vaccine. So that's going to give you a boost of that antigen and hopefully a better immune response. Flu block is not grown in eggs. It does not need the virus to replicate. It uses genetic information from the flu virus to be created, and it's synthetic. So it gives a little bit better of a boost also. And then there's Fluad, which is adjuvanted and activated. So it's a standard dose. It's not a high dose. It's a standard dose. So Flu Block and Fluad are standard doses, but the way they are manufactured, they give that better response, immune response. So anybody 65 and older, but if you're at your doctor's office, they don't have high dose flu or one of these, get anything you're eligible for. That's going to still protect you. So few FAQs with some of these big words. An adjuvant. What is an adjuvant? An adjuvant is an ingredient added to a vaccine to help the body create a stronger immune response. So in the past, aluminums have been used. People freak out about aluminum. there's more aluminum in deodorant, there's more aluminum in baby formula and breast milk than there is in a vaccine or even all of the vaccines. So that's an adjuvant, but it's been used for years to help boost that immune system in the body. We can use less antigen and use an adjuvant and get just as good, if not better, a result on our immune response. So I always tell people also, especially some of my children's friends who are like, what the vaccine for our kids? I'm like, if anybody should have autism or something, it should be me. Think about all the antigens in what we received, right? I mean, and my doctor had a cigar in his mouth while he was poking me. I still remember that. But that's the truth, right? And there, even in all the children's vaccines right now, there's less antigen than what were in like 4 of the vaccines 20 to 30 years ago. So just relative. So
The autism relationship to vaccines has been debunked. There's no relationship, correct?
none.
I have a son with autism.
Yeah, nothing. There's nothing. They've spent millions and millions and millions of dollars and studies and studies and studies to prove that that is not a cause of autism, right? And they're actually, the new research is showing for autism, just off track, that is actually starting in utero. They can see the changes in the brain. So they got to figure out more of that, but that is the thought process. And so why do we have to get a flu vaccine every year? These little buggers, they change up the strains, they mutate a little bit, and then we have to get a new one. It's just not long lasting yet. However, there is one in the works, and they're getting closer and closer to a universal flu vaccine. They found a part of the flu virus that they can actually attack instead of the outside of that flu virus. So there is another way of attack that they're going and figuring it out so that we can have a universal flu vaccine. When do you get your flu shot? Sorry about that. Now, by the end of October is the best time to get that. So it lasts you all the way through the season. We've had, H1N1 in May here. I worked at Hope for that one too. That was loads of fun. You get the spring flu. I had students when I worked at Hope, they got, flu A in December, and in April, right before exams, they were coming down with flu B. And it's like, did you not get your flu shot? And so we know that they're always circulating. We just have to change the vaccine to make sure, but we want to make sure that we get vaccinated so that the vaccine lasts through the whole season. If you hear about grandchildren getting vaccinated early though, that's okay for them. It is their first round of flu vaccine. Get it probably even August, early September, because they need doses timed 1 month apart. So that is a normal schedule for first all the way up to age 9. If you've never been vaccinated. Efficacy of the flu vaccine, we hear about that too. Some people are like, well, why do I get a flu shot if it doesn't work? If it's only, 25% effective. Oh, to me, 0%. Right? And yeah, they have to guess. Ones are going to be the prominent strains that are circulating, right? So their guess is sometimes great. It's been very educated. I've watched some of these some back and forth, and so they're doing their best they can. Southern Hemisphere has that have dealt with, but is probably a really good movement that we can get that, and we would, and it's thrown in along, right? And it's so may not stop you from getting to it. Just could or make that worse. If pneumonia, ear infection, sinus infection, exacerbate asthma. That's what that. RSV, that's a new one. I know people are like, what is RSV? Is all of a sudden around? No, RSV, respiratory, that's the substantial virus. And so it has been around, and a lot of times it's associated with just because that's when we are hospitalized. Well, it's actually older and elderly people also, and it causes this exacerbation of any comorbidities or other illness. So it's really important to be vaccinated, and we're doing more tests for RSV. So that's why it seems like there is more RSV. We have a better test that will test that. We're going to the emergency room, we're being tested for ours, so that we have it. So the rate of infections, like I said, and don't know that we're immunocompromised.
I have a question on RSV. Just a one-time only shot, or do you get it every year?
Is one time only right now. One time only. Yes. They're evaluating that, or as we know more about it, they're evaluating it, and this because also pregnant women can be vaccinated, but that means so the subsequent pregnancy would want to vaccinate after the child. So these are new guidelines out in April. So this might be different than what you remember from the prior season. So they changed the guidelines. It's all because the guidelines are kind of muddy. So it's all adults 75 and older are recommended to. And adults ages 74 who are at high risk for complications are. So it's those people 74 at high risk for complications, and those 75 and older should get. So now we have a should instead of a may. Really, for a physician to know how to guide them. And then there's a lot of medical conditions that increase the risk for RSV. One of them being in a nursing home. So that is one thing that vaccinate the living there. And then also ask your.
That cause any problem if you given RSV more than one time?
Shouldn't. There's numerous times we have to revaccinate children who come from other countries, have absolutely no records. All right, there's 3 options of RSV vaccines groups, and a Brisvo, a Rexv, Mresvia. Once again, we'd love to. But the Mresvia is brand new. Mresvia is an mRNA. Some offices are just getting it now. So you'll hear mostly the Brisvo and the Rexv. 1 lifetime dose. Additional research is being done to evaluate if we need it more than once. Right now, they're hoping, what I've read last at least 4 years. That may change as we get more research. And the CDC has no problem for any one of these. For those in eligible groups who have not received an RSV vaccine yet, that get it as late summer through October, effective for the upcoming. If you got it at another time, fine. Haven't had it yet, but time got it. Last year we were seeing a lot of RSV point already. They're not. RSV is really low, so might be getting after COVID with the mask. A lot of the respiratory just coming back on a normal pattern. They were coming back in weird times, right? Summer and things like that. So now we're probably going to our quality from what I have may have heard though that the RSV vaccine is FDA approved for 15 over or 50 to 59. It's actually just not recommended. There was not enough data that they felt confident recommended. There was a signal in the younger people, and they're like, you know what, let's just keep watching. If there's any other that come up out of that with not for RSV during vaccine during pregnancy. I mentioned that one, though, unfortunately, pregnancy with some caveats there. Early than the would have the RSV monoclonal antibody at birth, but overall it's one vaccine. Subsequent pregnancy, that subsequent births would have RSV body. So now we're at Tdap. The old DC, we're at Tdap, and if this vaccine protects against tetanus, also known as lockjaw, bacteria that are everywhere around us. There is no way of getting away from the tetanus. It can replicate when there is no. So puncture wound. A really cut where where you're gonna, bandage that up really good. That's where tetanus can grow. And so I always tell parents, children, if your child gets hurt, even if it doesn't look like it's emergency room worthy, and the immunoglobulin and they're like, why? I'm like, well, tetanus does kill. And so that's where they don't understand all of that. Diphtheria is caused by a bacteria that replicates nose and throat, make it toxic, that creates a thick gray coating in the throat and spread by respiratory droplets and infected objects. Wound diphtheria. Don't hear of this a lot in the United States. I am on a lot of travel emails. Outbreak. So anybody traveling, you want to make sure 1%, sure, but then that's why you want your Tdap. A lot of people say there was no vaccine and a TD or a Tdap or for a long time. So there was a D. And then pertussis. Pertussis is also known as whooping cough, and it is spread by respiratory and airborne droplets. And it's becoming more common in the US and around the world. The prevalence of pertussis in 2024, we've 5 times more than we have before. And October 5th, as of October 5th, had in Michigan. So, the ones who are at most danger, again, infants, they're full. Infants hospitalized, there is nothing but just trying to get those airways to open, and don't want to really one of those. I've heard one on my when I don't want to. So why are there more cases now? Tdap, a cellular pertussis. We used to have whole cell pertussis. We stopped using whole cell pertussis because in children and some adults there was getting pretty nasty vaccine reaction. Sometimes it was, or sometimes febrile seizures. So they studies and said, you know what, this is the whole cell. Let's try to go to an attenuated acellular pertussis, not whole cell anymore. It found that it was working really well. Not really good for long term. And stuck with us with cellular pertussis, don't want those side effects, right? But we're finding that the coverage wanes. So we've got some right now that have some pertussis that are fully vaccinated. And so they're doing their job, but that we know that of that. And we have people for to vaccinate. Really going to, so the more it's in our community or vaccinated, we're going to get it. So probably we'll never get rid of pertussis. It would be great if we were able to somehow, maybe mRNA technology, they'll come up with a better pertussis, right? So, but the pertussis is, the infants have this tiny ways, and that inflammation swelling, that's causes that. And that's why their risk of hospitalization. Vaccination is our best way to prevent it. Much more mild. Get it after we're vaccinated, fully vaccinated. Symptoms of that pertussis is that whoopy, barky cough. A lot of times, cough so hard they go up. Then they have that risk of kind of aspirating that back in when they do that. It can be mild. It can be. It also known as the 100-day cough. Antibiotics, and that cough will last 100 months. All right, I'm going to play you a little bit of a video. Couple minutes long.
I remember one of the first children I ever knew was 5-month-old parents, and I was so struck by
It's a fright. What happens is children, especially young, it's now are clogged with. They cough, cough, cough. So thick. Cough, cough, cough. Stop breathing. And then they breathe in heroin pipe, which causes that. But you're worried that they're not going to breathe in. You're watching them stop, turn blue. Frightening.
Now, I remember picking up on call and I would do it for the day. And those trucks I like are frightening. And I'm a mom of young kids now, and I can't imagine how being sick so hard and also knowing that
I mean, there's really not much else you can do. We're careful about it. Box is that shop. We're trying to prevent others. Once they're at the point you have this paradox, not much other the best.
and knowing that it's not after not just the illness, all of the other effects. Have you thought of
I think us as common disease never identified, or we all know pain. Times as a guy or about that. I think it's important is the fact that all infectious child gives those.
I see a lot of news. So when I'm talking often with the family to them, that we found them parents vaccine.
Right, protect especially that young child, rated.
All right, now that's just for infants, but for adults, and we want to protect all of those around us, right? So he recommends that adults receive that vaccine every 10 years. If you have a wound, if you go to the emergency, for another one, 7 years, but if you've had one within 5, you probably won't. Okay. Pregnant women should receive with pregnancy, protect that unborn child. So between 27 and 30 of gestation, so she can pass that immunity. Now, pneumonia vaccine. Oh, I'm just going to hit this with a highlight because pneumonia vaccines are so confusing. Schedule is very hard to figure out. And so we have an app on our phone to figure out doses and what doses. There's new vaccines on the market, protect different strains than other vaccines that are on the market. There's more that are being studied. It might be coming out to the market. So the whole goal of pneumococcal vaccine is to prevent severe symptoms. So they can be mild or severe symptoms, and then where the infection takes place in the body. So the more serious is your pneumonia, your meningitis, bacteremia, or sepsis. Kids, a lot of times, pneumonia or an ear infection. Adults. So all adults 65 and older are recommended to receive pneumonia vaccine. Adults 19 or with immunocompromising medical conditions or chronic health conditions. With our pneumococcal vaccine. Children with certain health getting one, then infants actually get 4 as part of their routine. 2 months, 4 months, 6 months at a year. So a really interesting little here that I'll quick say. Pneumococcal, it was called when people started when it became a routine children for that and series, we saw the rate of pneumococcal basically drop. Kids were the ones who were making the adults. So that's why they started the for adults, maybe drop even more. show enough of a drop. And so because once again, strains are a little bit as to which ones are causing the most buccal business right now. Back it. So it all depends if you've had one or not. When you had it, ask your physician. I'm going to leave it at that. So, had one between, or you may have had it because of a medical condition. You need another one. That's one thing. Just ask another or one. We have access to all this Numerex app that we use. Don't put any in, but it's just really nice to put in. And it asks us, do you have any chronic health conditions? Have any of this? When did they have their last pneumococcal vaccination? And it pops up and says, nope, they don't need another one. Or yes, they need another one. And really, really good. So the CDC pops up. Shingles. Reactivation of the varicella virus, right? There used to be a vaccine for shingles that was a live vaccine. We found out that it doesn't work as well. So we're moving on. But herpes zoster virus, it's that reactivation. It occurs in approximately reactivation of the chickenpox virus in your body. It occurs, there happens to about 1/3 of the people who had chickenpox. Sometimes you get it when you're younger, sometimes twice. I know somebody had it, right? And so it's miserable when you get it. Sometimes it's really mild. We have antivirals for that now, but manifests as that feeling, stabbing, numbness, blister type rash on one side of your body. 90% of the time, it's not going to go past halfway across your body. It's going to be unnerved dermatome. It's going to stay on the half that it starts. If it's on your face, it's incredibly dangerous. It can eye, it can cause blindness. Or it can cause some hearing loss. So it's important. Had chickenpox. There is a risk for chronic nerve. My mom had a time that put her in. Never got out of that with so much some pain. That's right. It was that bad. So not something I want to live with. My stepdad had it spread on his head, and it was outside. Had to put a stocking. So I think that was last. So the risk of shingles increases. Stress, and those who are immunocompromised are more at contagious. Not contagious like chickenpox. We don't have to worry about breathing on somebody or something like that. However, if somebody has not had chickenpox, but has contact with the weak stuff that's coming out of that rash, that person is at risk. Just had a 4-month-old. But the baby wasn't old enough. Not that the so mom, so we were wondering if mom even has passed that. Chickenpox and measles, those kind of passes last for about 10 to 12 months. So sure that got it. There's hope for Shingrix vaccine. Now yes, you want to get that. I think I was in one day when I went to get mine. I'm like, shoot me up. Anyone who's 50 and older, and then anyone 19 and older who is or will be compromised. So if they're going to start like a biologic therapy or maybe lupus or autoimmune disorder, want to get vaccinated, or they start that. And it's and even if you received the Zostavax already, which so that was the first one that didn't work as well, you're going to want the second one. Shingles vaccine is you're going to want shingles. Part vaccine, 1, and then second one, 2 months after that first. Get behind. We're down in Florida for that month time frame or whatever. Start up again. You don't start. This vaccine 90% effective in preventing the last for PFAS. And the prior vaccine effect was about 7. So uncontagious arm. Right. And this is the last one that is more recently recommended for adults is the hepatitis vaccine. Hepatitis prevents liver cancer. Hepatitis B vaccine prevents liver. Recommends this for everyone from age 9. Routine recommendation. So 6 years and older who are in risk also get it. And then 50 years of age and older may get vaccine. If you want to be protected, you may ask you want to be, especially if you're going on a mission trip. You're going to be working with kids, or even adults, or working in a medical clinic like that. Definitely. I'm not going to go through all of these risk factors on here because there's quite a few. But why is it important? More than 50% of all people with Hep B do not hepatitis. It's asymptomatic until you start having. So it's really important. Learn this with kids. I mean, tell parents this. Hepatitis virus live on a hot playground equipment for up to 7 days in 112 degrees. That's how long. So if you think about kids, grounds, and and I remember my kid when he had the worst accident on there, running up the stairs, cracked his head on a stair. There was blood. Like, I don't know if that got cleaned up very well. No, don't know. So, but important that you be vaccinated. And then there's recent recommendations for everybody when you go for your physical with your physician, ask if you for hepatitis. Recommend for everybody once in their life, or pregnant women, every pregnant. There's a few options of the hepatitis B vaccine. They're all acceptable if they're administered following the minimum guidelines. So there are 3 different ones that have 2 of them are just hepatitis. One has hepatitis and hepatitis. All are good. This is with your in your email. This is just a really dense, quick version of all the vaccines you could be due for as an adult. There are quite a few on there that most everybody doesn't need, but if you've got any medical condition, might need meningitis. Because if you have a cochlear implant, the meningitis, follow up with more meningitis. So there are certain health conditions that some people would apply to some of their, like a Hib when it's influenza. That would be for somebody who had a stem cell. So some of these on here would not be for every. There might be. That's why they come to us too. Or under regulations, FDA sometimes says, no, that Hib vaccine recommended. So that's why we give the are not supposed to be they are, but not FDA approved for some combination vaccine. But we do that. This is a really cool link on here. I won't do this, but if you have it, if you want to Google it, the adult vaccine quiz, you can put in your age, you can put in when you had vaccines, have your record, it'll tell you or to ask. Vaccine side effects or adverse reactions. I'm running out of time here, but we'll go through this. Adverse reaction is basically have an anaphylactic reaction where you can't breathe. One person in our COVID clinic come back in and like crazy, really having a hard time breathing. I'm like, okay, reaction. We took her EpiPen and got her, but the EpiPen, the epinephrine, and she started to calm down, but we sent her off hospital so that she evaluated that. But she had a reaction to an ingredient. It's probably something that she but then it affected it. So that's an adverse reaction. A side effect is a normal side effect. Red, sore arm. You can have the whole top of your arm be sore. You can have an ache at night when you go to have a little bit of body ache. You can have a fever. That is normal. Those are not adverse reactions. That doesn't stop you from getting another vaccine. Yes, it makes but ibuprofen, Tylenol, moving your arm a lot. That's really the vaccine approval process in the US. One of the best things that is, or one of the top pharmaceutical agents that is studied. They're more studied than almost other medication or drug, and have a lot more stringent approval than even drug. So we have to remember that when oh, there you go. I got hit with a wet noodle and pharmaceutical drug. They're using that in Europe. They're like, do you know what they do? They don't have a stringent as approval process. Theirs is the reporting website that we have to report if there is any error or any vaccine error or adverse reaction. So as health providers, we have to do this. Good, but not perfect reporting system. There's a lot of any Tom, Dick, Harry, anybody throw in here an adverse reaction. They can go in and say, I crashed my car because I had a meningitis. I'm not kidding you, actually. And so they just through all of that. That's how that one and the vaccine link. Actually, that's how they came up with the blood clot. Right. So that's how these things happen. These are actually our MICR, Michigan Care Improvement Registry. That's where all of our vaccines go into. It started out just for children. Now it is being used for adults. Ask your physicians if they put all their vaccines in MICR. Really important so that everybody will know, that pharmacy will know when you got your last pneumococcal, if you got your flu this year, if you got your COVID. So it's good for them to be putting vaccines in MICR. It is required for people under the age of 20. So any person under the age of 20 getting administration, MICR is going to be gone, and so MICR has outgrown all of. So they're on here. I say Michigan portal. You guys actually can do that. MICR has it for the public to go on the portal and their vaccines are in. And check that. I know that a lot of physicians have their own EMR now, right? And we honestly still have vaccine cards from probably that we're still on. It's important for all of us. Protect everybody else. And there's a kid and older children that some information on which one. It looks like a lot for kids, like I said last than ever before. But there's a lot of good websites. If you guys want to check out a lot of this. And then there's a movie coming out on a prop called A Shot in the Arm. And started before COVID, but and it was presented at the National Immunocompromised Conference. A lot of people saw it then. It's actually really, I saw it when out and we all were allowed a link. I was allowed like one click on it to watch it at one point. Awesome. We're trying to get people tested. So hopefully November that will be on, but it's called The Shot documentary about misinformation. A little bit of the yes. And I can stay as long as you want to answer questions.
Just a comment first that HIPAA weren't in place, put out our own information as medical that the COVID person came in, said, I don't believe in COVID, and they had to look his son in the eye who was dying of COVID. And how come told me this wasn't real, told me this. So having HIPAA doesn't allow us to put out the truth as we can tell the story. I have as a nurse, I had to have hepatitis B. But I never converted. I had the series several times, but I don't produce antibody. Is there any recent? I mean, that's for the 40 years I was a nurse. That was way back when, and every time I would try it, I wouldn't convert. So is there anything when upcoming?
Well, could try again if you wanted to. Heplisav, one of the hepatitis vaccines, dose series out of got a little bit of a different adjuvant, showing a better immune response. Three doses is good. Dose Heplisav B is a little better. They're finding because some nursing aren't showing that they have hepatitis B, antibody or immunity when they get their blood drawn for nursing school. So we're recommending that. So it's a thought. Well, some offices are carrying the Heplisav B. I say new. It's been around for probably 4 years, but that's what we're using almost. Just we have around just. But we're carrying Heplisav. First.
Toni, I have one question from a home visitor. This may be information category to talk about. He says some experts weighed the new COVID vaccine because it was based on synthetic. Consequences are unknown.
There's a lot of things that are synthetic that we use every day, right? So, I have a son who is a doctorate at Columbia, and he actually said, I've never met a science one. So if because there is a synthetic in there, that's not because they're trying to harm. It's not know. Just like we don't know, first polio vaccine. The scientists injected. So no, you don't know, but we don't know. But mRNA technology has been around for a long time, longer than what they has been used for immunology purposes in the research file. So I don't know. I always tell people it goes. You're getting more crap in the Cheetos than you are in the vaccine. I eat Cheetos. No, that's just something that you have to weigh your risk, and and everybody's got to do that for themselves. The risk versus benefit. And Dr. Offit, who did that video, honestly, he is a very, very common sense physician. Want to watch some of his videos? Got really good ones out there about, am I going to get a flu vaccine? Yes, I'm going to get a flu vaccine. When was one of the on vaccine related biologic fitting was one of the ones that do not recommend COVID vaccine for everybody at one of the meetings, because he said we're going to lose our focus on the most. He said healthy teenagers not need a COVID vaccine. He said people over or people who are immunocompromised or whatever. That to me is common sense, right? Let's use the common sense science. But at the same time, I understand. Hey, you know what? Then we're leading. Let's just the broad street, or what do they call the broad swath of everyone. Everyone vaccinated is going to protect. I do understand.
Well, you may have answered my question. So is COVID going to be a fact of life like we get the flu every year?
COVID's not going away.
It's not going away. Is COVID also a good time to get it like the flu? Because I like the idea of I always get it at the end of October. So is that kind of a good time to think about getting it to October, November, or?
They're hoping so that it goes that way. The spikes in the summer though, and so that's why they're not calling it yet. That spike is happening in summer. And so that is throwing it off a little bit. So they're not quite saying yet. But for us in this area, we're inside a lot, right? In the winter time. So we're going to spread a lot. Just like Florida is inside in the summer. So they're going to spread a lot around. So, that's where we look at it, and hopefully we won't have that spike, maybe one more.
I moved to Holland about 1 year before the pandemic. And when it struck, I became acquainted with the health department's daily briefing late afternoon that were televised. I have to say how positively impressed I was by the department, the information that was being conveyed about the reporting. Kudos to the department and the men and women who did that. It was an absolutely splendid work.
I will, you know, we've not, those people aren't here anymore. I mean, well, we do have an epidemiologist, Darrell, he was still on, and he's still with us, but Lisa, not with us, and, Marsha. So, but we have Addie Hanley. Oh, our health officer and deputy. When I see miss her, oh, little tiny powerhouse. So.
I just have a comment. So obvious, all the hard work he does trying to keep us all healthy. As long as we participate, live what everybody's goal is. I also brought in all my vaccination information and just to check with her. And I get my vaccinations at Meyer, and she talked about MICR, that report. They give me a report every time I get a vaccination. So I have a complete list. This is what it looks like. I checked with you, so you could tell me if I'm missing anything. I'm all up to date on everything. But if you don't want to go online, just ask your pharmacy. Go ahead and print the report for you. I did get one COVID vaccine in Florida, which is not here. The vaccine has to be on this report.
Actually, we add that historically, add it as a historical vaccine. Yep.
Okay.
If you ever want to stop by, just drop your record off, we'll add it.
Oh, okay. I might do that.
Yeah, we can add it right in. Yeah.
So, but anyway, I just want to thank everybody for coming today, and especially thank Toni for all this great information
Thank you.
and the time.
Thank you.
I know we took you away from your normal responsibilities, but you're spreading a lot of good information.
I
So,
hope so.
thank you.
Yes, and if you ever have any questions, call the health department and ask for me. I like to talk on the phone. So,
Wonderful.
yeah, not a
And
problem.
be sure to push your chairs in. That helps.